Good morning. So I'm Sharon, and this is Katie Hooven, and we're going to change things up a little bit by co-presenting, and we welcome you to the Philadelphia area. This is kind of our backyard, so.
All right, so the objectives for our presentation today is to define population health from a nursing perspective, to look how population health fits into the healthcare delivery system and the reform that we're going through, and then outline lessons that we've learned about relating and integrating population health into our nursing curriculum. So the definition of population health, and I know it's kind of like a pendulum that swings, so we now say population health, and one of my office mates has been a public health nurse for 40 years, and she says that this is public health, but just kind of a new way to look at it. So the definition of population health is health outcomes of a group of individuals, including the distributions of such outcomes within the group. It includes the health outcomes, the patterns of health determinants, and the policies and interventions that link the two. So I think more than public health, this is actually looking at policy and the data that influences the health of our community.
So this is the Institute for Healthcare Improvements Population Health Model, which is one of the models that we use for our project, which basically was taking the concept of population health and integrating it across our nursing curriculum, both undergraduate and graduate. So if you see there up at the top of this model, just briefly, I'm going to address some points in it. We talk about health equity, and the IHI, or Institute for Healthcare Improvement, does provide this framework for delivering health equity across the lifespan to all people, individuals, communities, regions, states, nations, internationally, and it also, its main focus is on safety and quality care. But it goes beyond what is the traditional medical model and focuses on prevention and health promotion, which is near and dear to my own heart. And it looks at all the different determinants of health. So you can start over to that far right side, or your left side if I think you're looking at the screen, at the socioeconomic determinants of health, at the physical environment in which an individual or community lives. It looks at many of the individual factors which are there in the green box. It looks at the immediate issue or the immediate problem if someone has a healthcare condition such as disease or an injury. It looks at how medical care is going to influence the state of health. And then overall, the outcome for this particular model is the well-being or quality of life of the individual or the community that we're looking at.
All right, so I'm going to talk a little bit about a grant that we received at the College of New Jersey through the New Jersey Nursing Initiative and the Robert Wood Johnson Foundation. And basically, the Robert Wood Johnson Foundation has coined or determined that population health is a huge issue in our community. And I guess the way that we kind of got there in nursing and the medical model is that we used to focus on healthy communities. We used to be upstream thinkers, so we would always go for prevention and outreach and health screenings, and we tried to catch these problems before they kind of arose or got worse. And then moving forward and kind of where we are now is now we're kind of like downstream, so we're just like catching the septic patients that come into the ER, and we're thinking about patients individually and not really how to work on prevention. So in medicine, we did attend a couple medical conferences, and their idea of population health is really data focused and how can they look at data of the community and kind of make changes. And so for nursing, we kind of said, a lot of the communities that are in major need don't have the data. They're not going to see primary health care providers. They don't, they go into the ER and they go into these systems that have fragmented EHRs. So we as nursing have a bigger challenge being holistic providers to kind of focus on population health. So our grant that we wrote for talked about incorporating population health into the undergraduate nursing curriculum, because we know nurses are the largest healthcare providers, and so then we think that we have a really unique impact on patients because we spend the most time with them in and out of the hospitals. We're in the communities. Everyone knows a nurse, so we figured nursing was kind of the way to start. So the strategies that we included were educating the faculty, because a lot of times in order to educate our students, we have to educate ourselves first. So we spent a lot of money on faculty development. We brought faculty into our system to teach us, and then we also sent faculty external to learn about population health. And we kind of used the model of the early adopters. So we kind of said, hey, who wants to be involved with this? Because we know that when you're working in a school of nursing, the last thing you can say is everyone needs to, or we are moving in this direction. So we kind of focused on the early adopters, and we asked people who wanted to be involved. And we got a handful of people that were really interested. And so those are the people that we educated first. And then during our faculty meetings, we had them kind of disperse their knowledge, what they were teaching the students, et cetera. The second part of it was student, I guess, curriculum, you could call it. So we looked at curriculum in the classroom and then linking it to clinical experiences, because we know that whatever we teach in the classroom is theory-based, and we want them to be able to translate it to practice. So we did incorporate things into the classroom. We modified learning objectives, which is something constant, because one of the things that Robert Wood Johnson said was, how do we know that this is going to stick after you leave? So a lot of times you have like a spearheader in your curriculum, and that's their focus and that's their expertise, and then they go to another institution and everything kind of falls by the wayside. So one of the things that we said was we were going to incorporate educational outcomes and course objectives that focus on population health. We also engaged our community. So we are located by Trenton, New Jersey, so there's a lot of need there. And there's a lot of opportunity there. So we engaged the community around us and the experts in the field that were actually doing this work. So we asked them, what are you doing with population health? How are nurses involved? How can we be more involved? Because we kind of saw that a lot of the population health initiatives were physicians, data people, social workers, physical therapists, and nurses were like not around the table. We're thinking, how do we get there? How do we get nursing as a profession to that table so we can inform some of the decisions? We looked at obviously research and other things that other schools of nursing have done, and looked at best practice when we were deciding on planning and delivery of care and delivery in the classroom. We obviously had talked about the interprofessional collaboration, so getting nursing at the table I think is just a huge issue in nursing in general. So we wanted to make sure we were there. Mobilizing existing community resources to better health outcomes. So there's a lot of money in these in these towns. There's a lot of policies that are in place, and most of the time it's just kind of mobilizing where are resources now, where do they need to be focused on. So we looked at that as well. And then obviously the use of informatics and technology, because the generation that's coming through with nursing is so big on informatics and technology and kind of the data that we get needs to inform our decision making with nursing. I did it again. I think you just go like that one.
Okay, so what are some of the things, and I'm going to give you examples of how we promoted nurses' role in population health. We already kind of talked about our role as a nursing profession is very critical, because we're very familiar with what I would consider the social determinants of health, and we're very holistically based in our focus. So we already kind of we've always looked at the patient and their family, and now we're just kind of expanding that. We really need to unite nurses in the workforce today. If we look at United States itself, we have over 3 million nurses. So we are the largest healthcare provider. We can make a huge impact, and if we involved all our nursing colleagues internationally, just think of our numbers and how we can impact care for individuals and families, local communities, regional, national, and international. So what population health does is it looks beyond those individual patient family needs and looks at resources in the community. And I highlighted this last question because I think this is a question everybody needs to ask themselves. What factors threaten the health of the population that I work with or that you work with? Okay, so we utilized in the beginning some big data and some community assessments to determine both the physical and social environment around the college, and then we kind of spread that out a little bit more. We definitely wanted to develop didactic knowledge, so after we did these kind of little sessions, the spearheaders and kind of the trainers at each faculty meeting, it was basically, we are a small college, so we have about 12 full-time tenured faculty, and I'm happy to say that all the tenured faculty now embraces population health, and it is integrated into every course within the college, going from maternity to pediatrics to adult health. This month it's going to be, for a summer course, is the second time I developed a course which is global health in nursing. So we're going to be it's going to be in that course, obviously. And then we're also offering some experiential learning that promotes competencies in population-based healthcare. So, for example, the last time with the Global Health and Nursing course, the cohort of nursing students that were involved in that course, mid-course, I took them and another faculty through an organization here out of Philadelphia. We took them to Haiti, and we set up mobile health primary care clinics across the lifespan. And we were there for 7 days, and then we were able to kind of come back and continue the course and really reflect on nursing's role in that particular environment that had poor healthcare resources. So this is just, I just wanted to share this rather than just talking. This is some of the pictures from that particular course and that particular outreach that we were able to take the students on. And these were mainly undergraduate students, because you hear a lot about taking graduate students and PE students to some of these sites. And I have to say that these undergraduate students, we went through a day-long kind of training session. We had what we called a packing party. We held a lunch and learn kind of prior to that, and they exceeded my expectations as far as health assessment and developed a real cultural humility. They went beyond that cultural competency. And this is a picture down below of our entire team, including those healthcare workers in Haiti that we kind of met on the ground that spent the week with us. So just kind of before I address this, I wanted to give you kind of real quickly an example of some of the things we did. So at the undergraduate level, as I said, we adopted population health premises into each of the courses. So we did that by some of the faculty integrated what they called windshield assessments into their course. So particularly in community health, the students would pick an area and they would drive through and they would do an assessment of that particular community or that population right from their car, right from, looking through their windshield, and see what they found within that community that they wanted to delve a little bit into in more depth. And then they could actually go on the website, the state of New Jersey website, the Department of Health website, and find out more about that community and then tackle some type of issue. We did the lunch and learns, which I told you. We did the study abroad. We did some simulations. We had a day-long interdisciplinary simulation that was targeted on poverty, so it was our poverty sim. So they kind of had to walk in the shoes of someone that did not have any resources, someone that was homeless in a particular community, etc. And we did some case studies. At the graduate level, we got involved with legislators, and they wrote letters to legislators. Some of them took a more active role and became an advocate on a population health issue. Again, they were invited to participate in the experiential learning, and one of the NP students did decide to go to Haiti with us. and she was kind of mentored in her role down there because by one of our staff, because Haiti does not have advanced practice nurses there, but all that was kind of set up beforehand. It's a lot of legwork going through the Ministry of Health. And then we also utilize some case studies. So these are the things, I guess, the lessons learned, okay? No matter how involved you're going to get or on what level you're going to get into the curriculum, and most of these are things that are addressed when you look at international health or global health by the World Health Organization. I think when you're dealing with population health, you also have to look at these things. You need to look at social justice and responsibility. You need to really try to build a relationship with the community that you're going to go into. But you can't just go in, drop in, do something, leave them without any resources or without any follow-up. So the example of Haiti that I'll give there is the reason that I chose the organization that we're involved in is that organization goes to the same sites every 3 months. So it is sustainable. They also have built a on-ground in Haiti building, all right, where they employ 2 Haitian family physicians and 2 Haitian nurses that act as, on behalf of the organization, as community health nurses, so that after students or healthcare volunteers go down there and intervene and treat, they continue to be seen. Okay, so another is resource allocation. You always need to kind of do an evaluation of that environment. So we have brought some public health students down, and that's their thing. So they look at water and sanitation and all them type of issues and can develop some types of projects. One of the things that we really stress with the student is the appreciation for diversity. You cannot go into these communities and develop partnerships and tell them the way that things have traditionally been done. You need to be open as to how they do things. So for an example for that is one of the things that we're going to do right now in the city of Trenton, hopefully, is go in and use the model of positive deviance and find positive deviant mothers that children are able to be active in a very volatile community, be able to do things, be able to be very healthy in what's considered a food desert, and learn from these mothers how we can tackle the issue of pediatric obesity, which is so high in Mercer County, New Jersey. Cultural humility, taking that step from being cultural competent to actually, developing that humility, and then capacity building, always leaving that community and giving back. So that's the end of our presentation. I just want to end it with this quote, which is an Arab proverb: "He who has health has hope, and he who has hope has everything." Any questions? That's
Do you use a special assessment? So which assessment do you use for this?
It's up to the adjunct. So the course leader is actually a public health nurse, and so for the RN and BSN students, they use this CDC assessment model, and then I think the undergrad used the HWO assessment model.
yes.
Mm-hmm. Yeah.
What percentage of your class went to Haiti?
For that particular trip, it was about 8%. But one of the things that they had to do when they came back, and we did not do it right away on purpose, was that once, about 8 weeks later, after they had time to reflect, they had to present a lunch and learn to the entire student body.
And then
from
they-
their reflections,
Yeah,
and,
they can reject
and then they also, through our community partners, hearing about it, were invited to go out to a federally qualified health clinic in the city of Trenton because they were interested in having the students present to them their lessons learned because they have a very high Haitian population that they serve. So that was like a wonderful kind of kudo bonus.
How did you pay for the trip?
It was
Trips are expensive.
Yes, it was. The students bore the cost of the trip itself. The organization that we work with does. I mean, we did shop around with that. So it was. They set it up through the college, through reimbursement with tuition, so they could make payments, the monthly payments, at the same way that they did tuition. And because it was within a course, they obviously had to pay for the course, but they got credit for the course, and then that portion of the trip was just kind of tacked on for their assessment. So it cost about $1,850 for the student, and that included everything. And then we, as a nursing department, picked up the tab just for transportation to JFK Airport in Newark and back, so that everyone traveled as a group. So, I mean, that was relatively like $850, but that included their airfare to Haiti, their room and board. We stayed at a guest house. 2 meals a day, their breakfast and their dinner. We basically, the organization, the Haitian American Caucus, where we set up the clinic, gave us lunch for 2 days. The other day, we packed peanut butter and jelly sandwiches and took them on the road with us. And it also included our interpreters' fees, and we had 7 interpreters who stayed with us and met us every day in clinic. And our Haitian nurse, Nicholas, who was the nurse that basically stayed with us all week long.
What about the students that didn't go? Because it was part of a course. What happened to the students? How did they make, how did you equalize the requirements of the course?
For this particular course, the first time we ran it, it was a very small cohort elective, and only those students that went on in the course, they all went on the trip. That was part of it, that they were going to do this. This time when we're running it, we're not doing the study abroad, but I'm incorporating weekly cases from internationally around the world. So we have a case here in the U.S., we have case based in Russia, cases all over, and I'm co-teaching it with a colleague of mine that is a Russian nurse, born, trained in nursing in Russia, came over to the U.S. for her PhD, and has been here now for 5 years. So we're going to co-teach the course, so I think that's a great perspective for the students.
So you just find these cases somewhere, and then you
they're
do
all over. Yeah, if you get into global or international health, many of the textbooks, like Jeannie Leffler's, some of the others, they have cases actually built into their texts, and we're using those cases. Some come with questions. Others, I kind of tweak the questions, and that's how the students will work on those cases.
That's great. It sounds great. And lunch and learn, people just bring their lunches, right? You don't provide the lunch?
No, we provide. That's an incentive for students to come on their free time, as you feed them.
So right, but you have to get the money for that, yeah.
Pizza,
But your school
we did this
gives
through
you
the
money?
grant.
We wrote a grant.
You wrote a grant, okay.
It was all grant funded, yes.
It's all still grant
We
funded,
work
great.
for the state of New Jersey, so we don't have a ton of money for that.
How many credits was this course?
It was one course unit, so it was 4 credit course.
Would that opportunity lend itself toward community nursing implementation? We do that for India, right? We expand to India, but where you went would be a good opportunity for students to do community nursing.
Yeah, for community, yes. Yes. And the graduate student also that went with us, she got 60 precepted hours from participating, because you say, you're there a week, but they're long days. You're exhausted. You basically fly in, kind of get yourself ready, prepared, take off the next morning, and don't stop until the day, the night before you're taking off. But it is a wonderful, life-changing experience. It was for me. I've been doing this now 6 times. Looking forward to it again this January. We're going to offer the course again and take a cohort of students. And I think right now we have about 15 that are looking forward to going, and they're all undergraduates.
What exactly do the students do when they're there?
They basically they did a couple things. They basically serve as triage. So they triage those that have very minor issues, patients or whatever. They will come in. Some of the students actually did the initial assessment, so those that triage sent them into their peers, and they did an initial nursing assessment. And I required them to kind of make a nursing diagnosis, and then they would kind of send them to one of the 2 nurse practitioners, as well as the student nurse practitioner. So there were basically 3 nurse practitioners, 1 adult gero, the student was an FNP, and I myself am an FNP. And then we would actually see the patients if we needed to. We had the Haitian physicians to consult with, although we really, as NPs, it was NP-based clinic. We didn't need to run anything by them. I ended up transporting a 15-month-old failure to thrive little man, Thomas, there. His mother had walked 4 hours to get to the clinic. He was extremely, extremely dehydrated, extremely ill, and we actually put him in our van with Nicholas, took him to the nearest Haitian hospital, paid his fees to be seen in the ER. I got in touch with ESF, who continued to pay his hospitalization fees there for 3 days. We were able to follow up, go visit at the clinic, meet his grandmother, meet his aunt, spend time with Mom and Nicholas, and we got him transferred to the Mother Teresa Hospital in Port-au-Prince, where as of last month I haven't heard anything since, because I've been keeping kind of tabs. As of last month, he was still there getting nutritional support. And because if they put him back into his environment his mother was basically homeless and had no resources. All right, thank you.